to date, we have one way of taking PrEP in the US that's been recommended, which is taking it daily. But there have been studies showing that taking PrEP less than daily can be effective. And specifically, studies have looked at a 2-1-1 regimen where people take 2 pills in the 2 to 24 hours before having sex, and then a single pill 24 hours after that, and another pill 24 hours after that. And that's been shown to be highly effective in preventing HIV for cisgender men who have sex with men. It hasn't yet been endorsed by the Centers for Disease Control and Prevention, but the WHO has endorsed it for MSM, as has one professional society, guideline society in the US, and a couple of individual health departments. We don't actually know how many people have started using non-daily PrEP in the US, or if they are using it, whether they're using the 2-1-1 strategy that's been shown to be effective. So we were interested in doing a survey, not in clinic-based settings where people are getting PrEP prescribed by a provider, but in a community setting where people may be getting PrEP from other places and maybe taking it in ways that their doctor hasn't officially recommended to them. So we did a survey in May of 2019 on a couple of national geosocial networking apps that are typically used as hookup apps for men who have sex with men. And we were expecting to get a few hundred respondents. We ended up with nearly 10,000 respondents. And they were all HIV negative adults, and most of them were men who have sex with men. And about 40% had ever used PrEP, and about a third had used PrEP in the last 6 months. Of those who had used PrEP in the last 6 months, we found that only about 5% were using PrEP less than daily, but many, many people were interested in using non-daily PrEP if it were shown to be safe and effective and if it were available. So definitely a high level of interest. And for the people who were using PrEP non-daily, the most common reasons for doing that were that they didn't have sex very often, which makes a lot of sense. It's a way that it can adapt to people's lifestyle. And also cost. Daily PrEP is expensive for many people, and taking fewer pills is going to reduce cost. What was concerning to us is that there was a range of dosing strategies reported. Some were using event-based strategies, specifically this 2-1-1 strategy that has been evaluated and shown to be effective, but other people reported using strategies that are not necessarily effective, like taking one pill around the time of sex. We don't know whether that's prevention effective. Some people were taking strategies that are probably effective, but have not been formally evaluated, like T's and S's, where people take PrEP only on days of the week that start with T or S. And we think that would maybe be effective because taking PrEP 4 pills per week has been associated with high levels of protection, but it has not been formally evaluated. We think the take-home point here is that it would be very helpful for the CDC to put out clear guidance for MSM on the most effective, the known effective way to take PrEP less than daily, which is 2-1-1, and has now been endorsed by the WHO. And people are already doing this, and they may not be doing it in ways that are prevention effective. And so that guidance could help people take PrEP as safely and effectively as possible.